again, Alona, your nurse educator and lactation consultant. Today is another day, another different topic that I want to discuss. Two people privately messaged me and asked questions regarding the painful nipple. And they want to know what's the best tricks, what's the best tips to prevent the soreness, the achiness, the cracking of that nipple. Okay, so I had this video before, purely probably in Tagalog, but today I want to discuss about in English because I know there are so many moms all over the world who wants to know on how to prevent that painful, achy, cracking nipple. I've been there because I was a mom. It happened to me. I did not know. I was so young. I didn't know what to do. And to the point that the pain, the bruising went into cracking, the cracking went into infected, and then it went worse in my experience. So I feel you, whoever you are, who experiencing nipple problem right now, because this is one of the most common problems that I've encountered in our breastfeeding clinic. Moms comes to our breastfeeding clinic crying, begging for help on what they can do to relieve the pain so that they can breastfeed effectively again. So I'm gonna pinpoint here, what are the causes of that bruising or painful nipple? The number one issue that we have encountered in the hospital after we discharge this mom is that most of them have lack of teaching when it comes to latching and breastfeeding. Yes, you gave birth, the nurse is there watching you how you breastfeed, but think about 3 to 5 days when your breast gets engorged, when your milk come in and the baby start refusing to latch, or you're forcing the baby to latch in a very awkward position, causing the painfulness of your nipple. So there's a big difference after you give birth at the hospital, when your breast is still very soft, the baby is still kind of still drowsy, tired after giving birth. So the baby will not do anything so much at the breast. But when the baby felt that hunger after maybe 12 hours, 24 hours, that's the time that the baby needs the milk. And without proper latching, during the first very crucial period of latching or breastfeeding, would really damage our nipple if you don't do it properly. Now, when you come home 3 days or 4 days, 5 days after your breast gets engorged, this breast here, what happened is this is very soft right now, right? This is the normal softness of the breast when the milk don't come in, right? But when you're fully engorged, this breast really gets really hard. And what happened is the skin gets so tight. The skin gets so tight, especially around the areola. The nipple itself stays the texture of it, but around the areola, the skin is so tight. So when you try to latch this baby, when you're ready for breastfeed, and the baby cannot fully latch deeply because your areola, your breast is so tight, that's the time that the baby's mouth is starting to slide down, and only grab the nipple area. And what happened? When the baby keeps sucking to that nipple area with a very shallow latch, the nipple started to bruise, to crack, or it's just sometimes some moms get really pinched nipple. Now, there are some tricks that I use when I teach moms on how to prevent the painfulness or the cracking or the bruising of the nipple. Now, I've mentioned this one before. When you latch your baby, so if you're holding your baby this way, I've always often, when I teach mom in maternity unit after they give birth, they always comfortable with the cradle hold. I agree with that. especially when the baby is like a full term or a bigger baby. But when you have a baby that's a smaller baby that really cannot fully latch deeply and the muscle tone is still kind of not fully developed, I would suggest to use the cross cradle hold. Why? When you do the cross cradle hold, the way what I'm doing right now, so when you're doing the cross cradle hold, I can really guide my baby latching properly to wherever the most comfortable position when I'm holding my breast. So if I do a C hold right now, I have full control of this baby where I'm gonna focus on latching deeply. So what I'm gonna do, always remember this, moms, when you're latching your baby, aim the chin, okay? Aim the chin to really touch down in your breast, okay? Normally, some moms would just guide the nipple, or let's say, we'll pretend this is the nipple, okay? We'll just guide the nipple. You can do that one too. Guide the nipple to open the baby's mouth. What I do is I make sure I hold the back of the neck and supporting my shoulder. And I want to make sure that this baby's chin would really touch the bottom of my breast. Because every time that, if the nose is touching my breast, like the way some moms would do like this, that means your latch is very shallow. Within few hours, within 3 times feeding during the day, you may notice that you have bruising in your nipple because the baby's latch is shallow. Now, going back to the breast is very hard. Why this is a problem when you're latching? Think about it when this breast is so tight and you try to latch this baby deeply. You cannot do that. So the baby's mouth will just keep sliding away. So what you're gonna do is, this is what my advice. What I teach moms is I want them to massage maybe 2 or 3 minutes, massage it, remove the milk. You can put the milk in a cup. So what I do is, this is what I do in the moms in our breastfeeding clinic. I let them massage, soften this, especially this areola part. Why? Because this is where the baby's mouth is gonna go. I want the baby to be comfortably able to latch deeply, especially with this areola part area. So massage it, express a little bit of milk, keep that milk, don't throw it away. So when you feel like the breast starting to get softer, then you can latch the baby. Now remember, the bruising of the nipple, this is what I've observed with my patients. If the bruising of your nipple, so this is, I'm just gonna use this. If the bruising of your nipple is below the face of the nipple, so this is the face of the nipple, okay? If the bruising is below the face of the nipple, that means your latch was very low. So adjust the baby level to where your nipple is, okay? If the bruising of the nipple is above the face of your nipple, okay? Meaning your latch is too high. So you lower the baby. So this is the biggest mistake when mom latch. So what the bruising causes, the mom does this. So the latch is too shallow. The baby's nose is touching the mom's breast, not the chin. So the latch is so shallow that the baby's lower gum, this gum, is pinching that lower part of your nipple. I hope you get it. So again, I repeat it so that you'll understand. This is the face of the nipple. If the latch is too low, the bruising or the start of the nipple damage would be mostly on the bottom part because this is where the baby's gum is. Now, if the bruising is on the very top of the face of the nipple, it's the upper gum that the baby is using it because the baby is that position too high. So what's that position too high? So this is probably very common issues that mom would do. What they do is, so this is the breast. Okay, just pretend this is your breast, level of your breast. What some moms do would lift it. They lift their breast up and level the baby's nose. No, don't do that. just hold your breast wherever your breast is, unless, this is exemption. If you have the so-called papaya shape breast that's really oblong shape going down, then you can lift it up. But if you have your normal breast size that stays, keep it that way. Let the baby guide the baby, but not your breast, okay? Not your breast. You can guide the nipple, of course. This is the trick that I used to. So if the mom is holding the breast, so you can do the trick. Sometimes you use your nipple to guide the baby's mouth, to open the baby's mouth by tickling the baby's mouth with the nipple so that the baby starts to open. This is one trick too, so that this baby would really open the mouth bigger to prevent that soreness, painful nipple. I spray milk, I express milk, I spray milk, I rub it around the baby's mouth. Spray, spray, spray. Now, when the baby start tasting that, so the baby was alert like that, so the baby would open that mouth big, okay? Now, there are so many tricks. I know there are some moms who would just do the chin like this, when latching. It's tricky sometimes, but so here's the thing. Here's when you're holding your baby. So when you're holding your baby, so let's say I'm holding my breast, right? So what I use my thumb is, I just do click. I adjust the chin, Some lactation consultant don't use that, but for some babies who are really lazy, sleepy, don't want to open their mouth bigger, I do that trick. Or what I do as well, so that the baby would really open the mouth bigger, I put milk on my finger. Put your milk in your finger, in your finger, and then let the baby suck that finger. Once the baby is fully sucking, maybe 10 or 5 or 10 times sucking, take the finger out and move your nipple in there so that the baby is already active, alert when you're latching. So that prevents some trauma to your nipple, okay? Now think about this. When your baby is starting to fall asleep and you feel like the baby is just the baby's mouth slowly sliding away from your breast, take the baby's mouth away, because that can damage your nipple when the latch gets shallower, when the baby is always almost to the finishing line, okay? Or almost finished feeding. So do it again. If you feel like, there's something wrong, I think the gum line now is in my nipple area, take it out, okay? Take it out, don't leave it there, because if you keep leaving the baby sucking just right into the nipple, guess what? Normally, a good latch, the nipples still stay round. A bad latch, after let's say you breastfeed for 10-15 minutes, the nipples start to get pinched, just like a new lipstick. You know what a new lipstick is? They're pointed. If you notice, when you unlatch the baby and you notice that your nipple shape is like a new lipstick, that means it was a bad latch. However, for babies who are older babies and they do so many positions in your breastfeeding, and when you unlatch the baby, the nipple shape is, see how this kind of pinch? Then you're probably saying, oh, I did not feel any pain, so there's no worry. So don't get too worried about it if there's nothing wrong with your nipple. But for new beginners, for new babies, we need to fix the problem right now that you're experiencing, because it's gonna get worse. I've been there. I ended up from bruising to crack to infected. I ended up quitting to breastfeed the other side to heal it. It took a while for healing because, again, it was a big crack. So nobody taught me the right thing to do, and I'm happy now, because I'm now a lactation consultant, that I'm happy to share you the best tips that I've learned in my career, and also when I teach these moms in our breastfeeding clinic. So I hope this video would help you a lot. You can share this video. Please do your comments, like this video if you like to, share this video, because I know there's so many moms out there who are just suffering nipple pain because of lack of teaching during discharge from the hospital. Thanks again for watching. See you more videos to come. Bye for now.